using *6. And we're going to go ahead and get started. Thanks again for joining us for this Dsrip dashboard webinar. I will apologize for my voice. It's not how it usually sounds. I got a cold like probably some of the rest of you. I think I should be okay. But if I'm a little fuzzy or if I go on mute for a minute, I might be coughing, but I'll stay on and try to be as clear as I can in terms of the audio here. So again, welcome. I see we have a bunch more folks coming on, so thank you for joining us. If you could go ahead and mute yourself, use your mute button or use *6. We will be having you unmute at the end of the hour. This is going to be a 60-minute webinar. And so at the end of the hour, we will be having an opportunity for some discussion and for questions. So, but at this stage, if you could go ahead and use your mute button or use *6, we would appreciate that so that everyone can hear. And again, for those of you just joining us, go ahead and mute your phones. I would appreciate that. And we are just about ready to get going. We have about 30 plus, maybe 35 folks registered for this webinar, and as I have a good number of you joining us, so we appreciate that. This is an important topic. The Dsrip dashboard, if any of you have had a chance to take a look at it, has some pretty valuable content that we wanted to highlight and showcase for you. So in terms of Medicaid services, being able to look at what services are being delivered where and the kinds of volume in which they're being delivered, in what regions within your county, at what zip codes, by which providers, can be some very effective planning data. And so we wanted to make sure that we highlighted that and shared that with you today. I want to welcome all of you on behalf of the Conference of Local Mental Hygiene Directors, Kelly and Betsy, who've been, of course, doing a lot of great work to help us to put together this, as well as all our other webinars that we've been doing as this community of practice for local planners in conjunction with our conference planning committee. Also want to thank the folks at CCSI. I know Ann Wilder and Michelle are on, and they're going to help to steer this webinar with us. And so I'm going to kick it over to them in just 1 minute. Again, for those of you who did just join, please put your phones on mute, either with your mute button or with *6, and that'll make sure we have good, clean audio for everyone. The plan for the webinar is we're going to look at the Department of Health tutorial on Dsrip. They've got a very nice, little less than 30-minute webinar that we're going to share with you. Then I'm going to share an example of some of my own work as I've looked at this tool and looked at this site and pulled some local data. That might be an example for you to think about. Mandy Teeter from Monroe County is also going to do the same with some work that she's done, and then we'll have some opportunity for question and answer and discussion at the end of that webinar. This is going to be a 60-minute webinar. We've done 30 minutes in the past. With this one, we felt clearly we need a little more time because we want to give you an opportunity to see that Department of Health tutorial as well. So again, for those of you just joining us, please do mute your phones. We'd appreciate you doing that, either by using your mute button or *6. And with that, I think I'm going to hand it over to Ann Wilder, who is going to queue up the DOH tutorial, and we'll get started with that webinar.
Sounds good, Matt. We're going to queue that up right now, and then when that comes to a close, we'll turn it back to you so you can kind of walk us through your local example.
Sounds great.
Hello, everybody, and welcome to our Introducing Dsrip Dashboards webinar. My name is Greg Allen. I work for the Office of Health Insurance Programs, and many of you have maybe had to suffer through my voice previously if you've listened to some of our other Dsrip webinars. This time I will be blissfully short, and we'll be turning the controls over to the really interesting and superior John Amasano, who will give you a detailed overview of live data in our Dsrip dashboard. But I'll just do a quick orientation to what you're about to learn, and I promise you this will be a pretty fun webinar. So the beginning of that fun is we'll just talk quickly about the purpose. We'll dive into exactly what the Dsrip dashboards are set up to do. I think you'll find here that we've got, again, an unprecedented visibility into the Medicaid program that's being created by Dsrip and is being advanced specifically by the Dsrip dashboards. John will again do that demonstration I talked about, and then we can talk about at the conclusion of the demonstration how these dashboards are fitting into our multifaceted performance data resources that are available on the website, and then talk a little bit about next steps. So the purpose of these, so we've been putting up quite a bit of data on our MRT website for Dsrip that gives the performing provider systems and their partners some information about volume of services, quality of services, et cetera. But what we've been hearing from many of you is that they really need additional data that you can interact with in a little bit more of a meaningful way. And so what we've really worked on the dashboards for is to try to present, frankly, an unprecedented level of visibility into the Medicaid program. Never before has the public been able to view such comprehensive information for the Medicaid program. But what we really did was we targeted this to help you with your community needs assessment, the overall planning of your Dsrip, and then eventually to feed your application development that's going to be happening probably late summer, early fall for your December application deadline. We're definitely focused the beginning of this on additional volume and member information that would help you to build your network. And then we have a bunch of quality information in here as a starter set, and we can add more as we get going that would guide you to selecting the right strategies and projects from your community needs assessment. So hopefully you will find this a very valuable resource. So what are the new Dsrip dashboards? So basically what we tried to do is to give you a method by which you could actually tailor your own experience of the Medicaid data. So we're presenting interactive views of what we thought were selected Medicaid utilization and enrollment data that would be helpful to you as you're building your Dsrip project. We also think this is going to have some general utility in terms of providing a lot of visibility into Medicaid services and utilization. We've customized filters we can add to this data and these filters over time, but we started with what we thought were a very important filter set for Dsrip. Number one is by region, and eventually we'll be adding, when we lock in on these networks, we'll be adding a filter for each PPS. But in the beginning, we start out with region filters, county filters, again, which are going to be important, zip codes, so you can actually focus in on pieces of your county that might have particular quality concerns and other key variables. One example you'll see is we can actually look at data by managed care plan. And then you can drill into, meaning that you can investigate further items of interest so that you can learn more, so that as you look at 3 given providers in one corner of your county, you can begin to select those providers and then look a little bit more about what happens to, what their patients look like, where else they go for services, et cetera. And then really key, you've all been telling us you need to be able to export data to be able to manipulate it locally, and we provide a functionality to be able to do that as well. What data are included here? So these dashboards present, again, as I mentioned, selected Medicaid utilization enrollment data. We pulled out all the key data. We're trying to take our data and turn it into information by selecting what we thought would be the most important variables. If there are others that you are looking for that you don't see, we're happy to get that feedback, and we'll teach you how to give us feedback here in a minute. This data is updated monthly on an ongoing basis, so these are not going to be a stale set of dashboards after 6 months. We will continue to put new data into them, and they'll present the most current information, and we go back all the way to calendar year 2011 through present. So I think you'll find that this is a very helpful tool. Just important to mention, there is no member-specific personal health information of any kind, so you won't see names in here or way to derive individuals. And in that regard, we have, following the HIPAA guidelines, we have blocked access to any cell count that would count numbers of individuals that were fewer than 11. Okay, so I'm going to turn this over now to John Amasano. He's the Director of Outcome Support at Salient, and I think you'll find John a very helpful coach. I'm turning the controls over to somebody excellent. So thanks very much for your attention to this part.
Good morning, everyone, and thank you, Greg, for that excellent introduction. And thank you, everyone who's watching this, for taking the time to watch our demonstration of the New York State Medicaid Dsrip dashboards. So I'll start by introducing you to the screen that you're going to see when you log in. First is our purpose statement up at the top. You can review this. It has some interesting links. And then we also have over here what data are included. And I'm not going to speak much to those because Greg already went through that information on the PowerPoint, but it is repeated on the website itself. And now I'm just going to bring your eyes right down to Section A, Learn to Use Dashboards. And right at the top of that section, you see the Take the Tutorial link. And I highly recommend that you take about 5-6 minutes to go through the tutorial. All you have to do is click on the screenshot of the tutorial. That will open the tutorial. And you can see it's a very simple format. It's going to point to certain areas of the screen, give you a tip. You click Next to go through it. Once again, highly recommended that you do this in order to unlock the capabilities of the data being in the dashboards. There are a lot of different interactions with the data that you have, and it really helps to go through this tutorial to understand how to get to those. Okay, I'm going to close up the tutorial. Next thing we provided to help you as you're going through these, the glossary of terms. I'm going to click on the glossary of terms to open it. Now, the glossary is just a lot of terms that we figured people might not use in their everyday life. So we have everything from filters, which are things you can use in the dashboards to narrow your view of the data, to make it more specific to your items of interest. We have software terms. These are salient dashboard terms that we use. We use them in the tutorial, we define them in the tutorial, and we also provide them in the glossary for quick access. We have measures. These are ways of measuring the Medicaid program utilization. Lots of different measures in here. We have dimensions. These are ways of grouping data together by a common attribute, so things like age or county. And then we also have in here a few general definitions that we use often, such as right here, date of service. This is just going to provide some more information to you. So anytime you come across a term you're not familiar with, you can just go to this glossary and get some more information about that term. And we'll be using that as we go through these dashboards. So I'm going to close the glossary, return to the landing page, and scroll up a little bit. One last resource, a must-read. Put it on your summer reading list. It's Read More About the Data. I'm going to open that up, and let's take a look at what this is. This is some information about the data that's in these dashboards. Really important for understanding how to interpret this data. Also, sometimes you'll see some things that look a little weird, and there are explanations for those things in here. So definitely check out the About the Data section. Okay, I'm going to return to the landing page. In the community that are going to be important for providing care. And then we also have Section C, Assess Community Health. Now, right now, the dashboards that are under Assess Community Health are all about the utilization of 3 major types of service. There's ER, primary care, and inpatient. And these provide you with a rate per member month so that you can understand the utilization of those services. And we also have a trend that's going to show you how those have changed over 3 years. And we're going to take a look at a couple of those as well. So enough introduction, let's get into a dashboard. As you look under Section B and you look at each one of these dashboards, each one has a primary question. This is the primary purpose of this dashboard. And if you hover over that, it's actually going to call out what the name of that dashboard is. But this is just to point you towards which dashboard to open to answer the question that you have in mind. So we'll look at this first one, where do members go for services? And I'm going to open this up. And this dashboard is all about understanding members from a certain catchment area go to which service counties to receive services. To understand this dashboard better, we also provide a knowledge manager panel over here on the right side. And if we look at that panel, it has a few different things. It has the formal title of the dashboard and the primary question. It has a purpose of the dashboard, and then it has a few step-by-step instructions for you to follow to answer that primary question. We also have a little information down here about optional filters that you can apply to do another type of analysis or to make your analysis more specific. Down at the bottom here, we have some resources. We have the tutorial. You can link directly to that. The glossary of terms comes in handy, and back to the about the data. So I'm going to collapse this for a second. We'll go back here in a moment, but I'm going to collapse the Knowledge Manager panel to give myself more space. Let's take a look at the dashboard. So over on the left side, I have my filters panel. These are what we use to make our views more specific. And right now, everything's set to all. So when all of these filters are set to all, that means we're looking at all Medicaid services provided during calendar year 2013. This first widget on the left here looks at claim and member counts by service county. And that service county refers to the county where the member is actually receiving services. And we can look at a claim count and the unique number of members receiving services in that county. The view on the right shows you that same information, the claim count by county, but just in a graphical view that's more easily interpreted visually. So this claim count, I want to say a little more about that because it's not necessarily something you use in your everyday life. This claim count in Medicaid can refer to a count of procedures, to visits, to entire episodes of care. And it's just a general indicator of utilization for us in this system. However, what we've done here is we've summed together the total claim count for fee-for-service Medicaid claims and also the encounters that are submitted by the managed care plans. So this is showing you total utilization within a county or by a type of service, and it's going to be in a lot of these dashboards. All right, so let's get into this and start doing analysis. Now, the first thing I'm going to do is apply a filter to look at my catchment area. Now, since we're doing this webinar right here in the Capital District, I'm going to go to the Dsrip region filters, and I'm going to apply a filter for the Capital District. Now, as I close this menu, the filter's applied, and as you can see, these two widgets are going to update to reflect the change that I've made. Now I'm looking at information just for the Capital District members that are enrolled in Medicaid in 2013 in the Capital District, and I'm looking at the county where they're actually receiving services. And I see Albany, Schenectady, Rensselaer come right to the top. And what I'm going to do is just make this a little more specific by turning on a service filter. I'm going to go to Service Type Group, and I'm going to apply an inpatient filter. So we're just going to look at inpatient services. Once again, I apply by collapsing the filter box, and I can see same basic list of counties, smaller claim counts to reflect that my filter has been applied. And I'm going to look at these top three counties here, Albany, Schenectady, Rensselaer. I'm just going to check those. And right at the bottom of the screen here, you can see that now I have a subtotal for those three members. So it's very easy to subtotal these members. Now there's one more step I'm going to take in my analysis, which is to step down into these three counties and see who the providers in this region are. So I'm just going to select this down level pointer here, and I'm going to select drill into checked rows. Now what this is going to do is just in this widget only, it's going to apply another filter that says just for those three counties, and now I get to a provider level. And these are the inpatient providers in those three counties who are providing services to members in the Capital District for inpatient services. Okay, so I like this view. I like it a lot, so I'm going to keep it. And to do that, I'm going to export it out of the dashboard. So I'm going to go to the Settings panel here, and I'm going to select Export. Now the dashboards allow you to export any view you have as an Excel file. You click OK, and it's going to save that Excel file in your browser's download file section, whatever those settings happen to be for you. Okay, I'm going to cancel out of here, and let's go back to the landing page. All right, that's where members go for services. Section B, like I said, is all about understanding who goes where, for what types of services, and who do they see. Now I'm going to go and look at Section C. And as a reminder, this is all about utilization of three major types of care, ER, primary care, inpatient. And it looks at the rates per member month for those types of care. And number 6 starts with ER. And this is answering the question, how often do people go to the ER in your catchment area? I'm going to click on this dashboard to open it, and let's take a look. So once again, Knowledge Manager panel, your friend on the right, it's giving you information about the purpose of the dashboard and step-by-step instructions to apply your catchment area and to get the information to answer that primary question. I'm going to collapse this for a second. We're going to go back here again. And let's take a look at this dashboard. As you can see, like any dashboard, you come in and all of the filters in your filter panel are set to all, which means that we're looking at all ER visits during calendar year 2013. And in this top widget, you can see that visit rate per 1,000 members broken out by member county. As a reminder, the member county is the county in which the member is enrolled in Medicaid at the time of service. Let's talk about this for a second, per 1,000 member months. I know most people in their daily lives don't speak about things in terms of member months, so I'm going to go into Knowledge Manager to get a little more information about what that means. I click here to bring that panel back. I'm going to go to the glossary of terms. All right, here in the glossary, I'm just going to scroll down. Everything is nicely in alphabetic order. I'm going to scroll down to member months. You see, this is the sum of individual months of Medicaid enrollment for all members in a given time period. For 1 month, this is equal to the number of Medicaid members. But for 1 year, for example, if John is a member for 9 months and Rich is a member for 7 months, they account for 15 member months within that year. So I'm going to close the glossary now with my new understanding of member months. I'm going to take a look at this data. So this is showing me that I can hover over any member county and see how many ER visits there were for every 1,000 member months or months of member enrollment. And I can compare this to this widget on the bottom. Now this widget on the bottom has a little note here. It says filters do not apply to this widget. This is a static widget. And what it allows you to do is compare the rate in any county to the rate in New York City or the rest of the state, sort of give you a baseline to understand those numbers. I'm going to collapse Knowledge Manager here to give myself a little more room, and I'm going to apply a filter. Once again, I'm going to apply a Dsrip region filter. I'm going to focus on the Capital District. I'll collapse it. And what this is going to do is limit widget number 1 to just the counties within the capital region. Notice that widget number 2 does not change. That filter does not apply to that widget. And now I see at the end here, at the last bar on each one of these bar graph views is the total. Now this total, I just want to mention for a second, this is not an average rate. This is a summary rate, meaning it's taking all the member months in all of the capital district counties and all of the ER visits that those members access anywhere, and it's providing you their ER visit rate per 1,000 member months. And I can look at this rate and, of course, understand that rate a little more by comparing that to the rest of the state. All right, so let's move on to the next dashboard. We're going to close this tab. I'm going to look at dashboard number 7. How have ER utilization rates in your catchment area changed over the last 3 years? I'm going to open this dashboard and take a look. Once again, Knowledge Manager panel on the right. I think at this point you understand that. I'm going to collapse it, and let's take a look at what we're seeing. Once again, the top widget is showing you the emergency room visit rate per 1,000 member months, but now it's showing it to you by month, which allows you to understand how things change over time. And also, you notice in my filter panel, no filters are applied. So this is the rate for the entire state of New York Medicaid enrollment over these 3 years by month. Now I can apply a filter to this to make it specific to an area, and I'll do that. Now I'm doing this webinar here in Albany County, so what I'm going to do is select Albany County as a filter. Okay, so let's take a moment to do some basic interactions with these views. Once again, the widget on the bottom is static, so these numbers do not change based on what you select to filter, and that allows you to compare to the rates for New York City and the rest of the state without worrying about those rates changing based on your selections. And what I'm going to do is I'm going to select a time period. I'm going to select 2011 up here at the top so I can understand ER rates during 2011. And to do that, I'm just going to drag my cursor over that general area. And it's going to load for a second, and then it's going to give me a little pop-up that shows me what the rate was during that time frame, a summary rate. So all visits, all member months during that time frame for Albany County members. Now I'm going to go here to 2013. I'm going to do the same thing and compare these 2 years to see how ER visit rate changed over that time frame. And I can also compare these rates down here at the bottom to New York City and the rest of the state. So what I'm going to do is just rubber band an area for those 2 trend lines so I can understand what the rates were in those 2 areas during that time frame. Okay, so that's about as much as I'm going to demonstrate from the dashboards today. To see more, you'll have to log in and start playing with them. It really is a lot of fun, so I encourage you to get in as soon as possible. When you close this dashboard, go back to the landing page. Remember, you have lots of resources to help you as you're going through this process. But one of the most important resources is our support line. So Greg set up a team of people who are ready to respond to your questions, and you can reach them at dsrip-dashboards@health.newyork.gov. Once again, I really appreciate you taking the time to watch this webinar. I'm going to kick it back to Greg for the conclusion.
Thank you, John. That was excellent, and I hope you all found that to be as useful as I did. These, just again to frame this from the perspective of other available information on our website, we have quite a bit of information that's already available in advance of having these dashboards available. So again, I don't want folks to lose focus on the fact that we do have a performance data section of the Dsrip website. You can see the navigation pane over to the left. That is the pane that exists on all the Dsrip websites. Inside of that performance data webpage are links to regional chart books with thematic map views, and in particular right now there's views of the PQIs by zip code that basically establish PQI heat maps. I think you'll find them very interesting. It might even be interesting to guide some of your investigation into the salient data, which may help to explain some of those potentially preventable admissions. We had previously provided also salient data workbooks by region. These were mainly developed to guide volume information for network selection. I know many of you found them helpful. They are now probably superseded by the dashboard, but again, I think those are there. They're pre-formatted. They can be utilized as well. There's a wealth of information on PQIs there. Medicaid inpatient admissions and ER visits, we've got more specific information. There's the prevention agenda, and then all the data that's available on Health Data New York. It would also be very helpful to the Dsrip enterprise. So again, just wanted to take a second to frame this from the perspective of other available information, and please do continue to check back. If you are a member of the MRT listserv, you will get notification of updates on the website. So if you've not signed up for the listserv, there's also a link on the Dsrip website to sign up for that as well. Just going to say our next step is, these are the first wave of Dsrip dashboards that we are launching. They'll be posted to the Dsrip website here in August. And then more dashboards will be added as we move forward here on utilization, quality, and performance data. And this, again, is all in an attempt to continue to help the PPSs and their partners in fleshing out that community needs assessment, continuing your planning, and rolling up into your application development. We have put aside a team that's specifically dedicated to answering your questions on the dashboards, and they can be reached at the email address that's listed here. Easy to remember, dsrip-dashboards@health.ny.gov. So that concludes our webinar. I hope you enjoyed it, and thanks very much, and thanks for all the hard work that you all have been putting in to Dsrip in such a short time period. So thanks a lot for all the work.
Okay, so thanks for listening to that. That was, of course, the pre-recorded DOH tutorial that you can find. I'd encourage you, if you want to take another look at that. It's a pretty dense presentation, so they move very quickly through some of the details for how to use that Dsrip dashboard. You can certainly go back to that and view it again, or share it with others you might find could use some information about how to use that dashboard. Dsrip dashboard at health.ny.gov. which is, of course, the location for accessing the dashboard, and you can find the tutorial there if you want to share that with other folks. So what we want to do now is to spend the second half of our hour talking about some local examples, hopefully reinforcing some of the material that you just saw from that tutorial with some stuff that I have done and that Mandy Teeter has done from Monroe County. So I'm going to start, and I see Ann has pulled up the landing page, and so I started to poke around and look at the information and decided, well, I'm going to take a look at Section B and the dashboard number 4, which is about Medicaid members by primary diagnosis class, and it asks this question: what type of conditions are being treated? And so I'd like to share with you a little bit of the work that I did with this. Just as a starting point, one of the things that I found particularly useful in this dashboard is to just get some really good lists of providers. If you want to take, you can grab a quick list of every provider of a certain type of service area, or if you don't click every Medicaid provider, but you could just filter on mental health providers in your county or in your region. And so just for the simple purpose of gaining a list of every person who had a Medicaid billable service as a provider, this is a really nice tool. And then, of course, that export feature that they showed on the tutorial in terms of going into that settings tab and then pulling it out to Excel. I'm not going to be doing that with you here as an example. You saw that on the tutorial, relatively simple and easy to do. But I just wanted to point out that simple list thing. One of the things I'm always doing is looking for good lists. Give me a full list of everybody who's doing a certain something. And with regards to Medicaid, I think that this is a really good source for doing that. So with that said, let me share with you my exploration here, my example that I looked at here as I started to look at this particular dashboard before. I took a look and decided, you know what, I'm really kind of interested in the more granular zip code level data, because when we start to think about particular subsets of our community, particular areas within our community, I was kind of curious about looking at a little bit of that using this tool. So and we're not going to filter this live. I'm just going to kind of walk you through and tell you what I did. Obviously, you can filter by your county, then you can filter by specific zip codes, and then you can grab the data. I was looking just at mental health disorders, mental disorders. You see that highlighted top row there. And then I pulled some data from several specific zip codes. So I obviously had to know my zip codes and know what I wanted to take a look at. And then as I did that, I was able to then pull each of those into a spreadsheet. First, before I show you the spreadsheet that I created and kind of talk with you a little bit about some of my findings and interesting material that I gathered from this particular dashboard, I wanted to just show you a quick map, which gives you a sense of the city of Syracuse and some of my questions, some of the things I was thinking about. So thanks, Sam, for pulling up that map. So I decided, as all of you might do with your own communities, thinking about particular towns, in this case, I decided to focus in on the city of Syracuse and to look at some specific areas within that city. So you'll see in the spreadsheet that I show you, I pulled out some general data for a comparison for the whole county. I'll get to that when I show you the sheet. But then I decided, well, I want to focus on some specific zip codes. One is the north side zip code, which you see at the very top of that page, 13208. Which is a neighborhood that's had a lot of transitions recently over the last couple of decades. I wanted to look at the south side zip code, 13205, which is a relatively long, thin zip code, which there you see the label on that, 13205. Thank you, Ann. And it's a long, kind of thin zip code, almost exclusively an African-American zip code, relatively poor portion of the city, and a neighborhood that's gotten a lot of painful publicity in terms of gang activity and crimes, et cetera. And so I wanted to kind of take a look at that as a comparison point. I also wanted to look at the near west side, which is 13202, which is a real small zip code that shows kind of right in the middle of the map, just to the west of downtown. 13202, just to the west of downtown. Very small area, which has been an area that's been studied quite a bit, has had sort of a painful reputation given some of its infant mortality, one of the highest levels of infant mortality in previous years in the country, extremely poor, and very high levels of crime. And then the last one was a zip code out toward the east, which was 13206, which you see just to the sort of at about 2 o'clock on the map there, which was more of a working class neighborhood, traditionally a very Italian part of town, slightly higher incomes, a lot of blue collar family-owned residences in that neighborhood. So I thought, well, I'll sort of pull that out and do some comparisons. It was a little bit arbitrary in sort of deciding, but I was just kind of doing a little bit of exploration. So I did that filtering that I discussed, and I'm going to have Ann pull up that spreadsheet that I completed. I did that filtering that I discussed on each of those zip codes and pulled up some data, and I wanted to just use this example to you to kind of show some of the things that you can do with this this sort of data to help you to look at this information. Obviously, pulling together data usually adds to more questions, which is what this did, but it's kind of like a breadcrumb trail that leads you towards some insights. So as you can see, what I did was I pulled out provider information across these 9 providers. Several of them are very large. These are some of our more major large providers of mental health services. The final provider at the bottom you see is Dr. Ghali, who is has a very large psychiatric practice, private psychiatric practice. So I thought, well, that'll be an interesting piece to kind of pull out. And so you'll see that across the top row, you see the multiple zip codes that I just described and showed you on the map, a comparison point with the full county. As I look back at this, I might want to go in and instead of the full county, I might want to also add in the full city as the comparison point, where I would take all of the city zip codes, and you can just click all the zip codes that you want to use if you were on that particular dashboard, and get the aggregate information for all of those zip codes, and then compare those, which would probably, as I look at it, be a better comparison. And then compare it across these zip codes. And this was the information that I gathered in each of these zip code sections. The dashboard gave me the claim count for each of these providers, and it gave me the unique members with services. I added in the third column in each of these sections, in each of these zip code sections, which was the mean claims per member, which is the simple division with these numbers. If we see in for Crouse, for example, for the full county, 82,000 claims, almost 2,000 unique members. That means 41 claims per member. So I just added that in as that kind of per capita claims per member number. Obviously, we have different volumes across these different providers, so that mean claims per member number is kind of a helpful way to think about it. So some of the things that I started to then explore here related to just a quick overview, because I know we're going to shift to Mandy in a minute or two here. Huge number of CAB claims, which I didn't even look at here, and I just made a note because I was just doing mental health services. But in the near west side, almost no folks owning cars, a very small number of cars, and something that I would have known already, of course, that there would be a lot of CAB claims, but it sort of drew my attention to it. You also see that I put in red some of these zeros, which of course makes us always suspicious. Is that an error? Are there claims that are showing up under something else that are not showing in here? Is it the case, for example, that folks from the near west side, none of them are going to Liberty Resources or to Syracuse Brick House for mental health services, behavioral health services, or Central New York services? Again, for the near west side, we see zeros. That's possible, but I was kind of suspicious or curious about that, so I need to do a little bit of research about that. One of the things that was kind of interesting in terms of claims per member, if I look at Crouse, for example, and Onondaga Case Management, which is in that row number 10, and again come back to the west side and I look at the claims per member, and I look at for those providers examples, the claims per member, for example, for Crouse is 6 versus claims per member in the other zip codes, which are significantly higher, which leads me to think about engagement and folks leaving against medical advice, and which leads me to ask the question, are these folks serving a certain number of folks in this particular community, near West Side community, and are they not effectively gauging them, and does that have anything to do with some of the variables that are unique to that community? And so this would be something I might want to explore with those providers and say, let's talk a little bit about how you're doing with folks from that community who are receiving your services. For example, there's a significant number of folks who speak Spanish in that particular zip code. Is it the case that that has something to do with this low mean claims per member? Is it a reflection of a lack of engagement? Also interesting, when I look at Dr. Ghali and his very small numbers from some of these zip codes, the 0 number from near West Side does a significant amount of services, but very small numbers. If we look at his total, obviously more of the folks from the outlying areas outside of the city or from other zip codes. Makes me want to check out some other zip codes and see, well, where exactly is this practice drawing from? Because there's very small numbers from these particular zip codes. So as you can see, this is kind of a way to start to poke around and explore. This nice simple exporting feature allows you to create a nice table, explore, kind of do some comparisons, pull in different points of comparison, and start to ask some tighter questions at the zip code level, which I think is a really nice way to start to get to the local community. And as I said, for you yourselves, if you have a larger city, comparing within the city, those smaller units of the city or across towns, across your communities, and saying, how are we doing? Do we need to target specific interventions, specific improvements toward particular zip code level areas to try to ensure that the quality of care is there, that the access to care is there, and also looking at issues of more segregated areas in the community, racial disproportionality, et cetera. And those are some of the features that I'm starting to explore here as I just begin to kind of map my way through using this particular filter and this filter set from this particular dashboard, which is B4. So that's one example for you. Now I want to transition to Mandy Teeter, and Mandy's going to share some of the work that she's been doing in terms of exploring some of these dashboards.
Thank you, Matt. So I'll be moving into the section C of the data dashboard. So we're going to go back to the Dsrip data dashboard page and see the different sections. So in thinking about an example to share regarding the data dashboard, it really had me start thinking about looking at planning and looking at regional resources through a regional lens. And as we know from the local governmental units, looking at services from a regional lens is not something that's new to us. We're aware that folks access services across county borders, and that in order to really ensure service delivery meets the needs of populations, we talk to our county partners regarding behavioral health services. I think what the Dsrip dashboard allows me to do is really start thinking about this new region that's being put forward, whether it's through Dsrip, whether it's through the regional planning consortiums, or through the FIP partnerships, the population health improvement plans. They're really looking at different regions than maybe historically I've looked at before. So what I'm going to do is I'm going to pull up, I'm in section C, Access Community Health, and I'm going to pull up this first dashboard. How often do people access ERs? So based on the webinar that we watched from Department of Health, these section C dashboards really focus on emergency room use, inpatient use, and access to primary care physicians. So when just thinking about some of this data, it's important to really be aware of what is included in this data. And I think for me, when I was looking at it, one thing that didn't immediately jump out is what do they mean when they're talking about their region? So if you click up in the corner, it says Member Dsrip Region. And I look at the examples of the region that we're referring to. So some of the questions I initially had are, what do they mean? Do they mean when they say the Finger Lakes Dsrip region, do they mean the Finger Lakes Dsrip application for our community? So I think most local government units are working with local Dsrip applications. I know within our Finger Lakes region that includes a 15-county region. So it was important for me to understand, will that Finger Lakes region include all of those 15 application counties? And it's really not intended to be a reflection of the Dsrip applications that are coming out from each region. It's really a reflection of the Department of Health regions that they've identified, which also mimics the regions that the conference's regional planning consortiums will be moving forward. So what I'm going to do is I'm going to pull up the map that identifies what those regions are, just so we have an opportunity to revisit who's in these new regions and who are not. So for the Finger Lakes region, Monroe is in the Finger Lakes region, and we're in this purple section here. So that's a 9-county region. It includes Monroe, Wayne, Livingston, Ontario, Seneca, Yates, Steuben, Schuyler, and Chemung. So folks, when they're looking at these regions, it's important to go back and take a look at which region you fall into, when it's specific to the Department of Health, when it's specific to these dashboard regions, because they may be slightly different than regions you've worked in the past. I'm going to close that. What I'm going to do is I'm going to click on the Finger Lakes region. So what this is giving us is, as the initial webinar explained, the number of emergency room visits per 1,000 member months by member county. So I see those 9-county regions that I referred to initially, and I'm able to see what is the rates of folks visiting those emergency rooms per county. So this includes folks presenting for psychiatric needs as well as physical health needs. At this time, the dashboards don't reflect kind of the reason folks are presenting to the emergency rooms. And you see quite a variation between the different counties. When you hover over the counties, you can see the rates per each county just to get oriented to the data. And like the original dashboard webinar stated below, we can see New York City's rate, we can see the rest of the state's rate, and that doesn't change regardless of how I modify some of the filters to the left. Something else that I'm interested in taking a look at is by age group. So I'm going to modify the age group, and I want to see what this looks like for young people. So folks between the ages 0 and 17, again for this region. And you'll see some of the variations that exist. So I know historically when looking at regional planning, we've spent some time looking at regions that are specific, just one example, are regions that are specific to the psychiatric inpatient program located in Monroe County that really has a catchment area of 6 counties. So I think there's lots of examples we could all share of times that we've been able to look at regional information. I know specifically on behalf of Monroe, we spent a little bit less time looking at this information by our RPC region, and it would be important that we are starting to look as a region how we're performing on these data outcomes and get a better sense of why some of these variations exist. I think we could initially have general sense about service availability within the different counties, but it's pretty clear that we recognize that the variations, we need to dig into that data a little bit more. I do want to demonstrate the exporting ability because it wasn't really demonstrated in the webinar, and I think sometimes that's where folks are really interested in taking the data out of this framework and putting it into Excel or another format that's more manipulatable. One other great ability within the data dashboard is the ability to switch from graphs into the actual numbers, which sometimes I find easier to look at the numbers and manipulate the data in that way. If I was interested in exporting this data, you see there's 4 bar graphs to the side. You click on that and go down to the export. You see it gives you the option for Excel. Typically it also gives you an option for PDFs if you wanted to pull it together for a presentation or a PowerPoint. You'll see it opened in the bottom corner. I'm just going to open that up. now I have that same, looks like that's Matt's data. So this is the data that we were just looking at on the Dsrip data website. I've converted it into Excel where I'd be able to start manipulating some of that data within house. So I know we have about 10 minutes left in the webinar, and so I will turn it back over to Matt. I know we want to open up the opportunity for other folks to ask questions and talk a little bit more about the usability of this data Dsrip.
Excellent. Thanks a lot, Mandy. So you see some examples at different levels of the continuum in terms of how you can look at this data from the more granular zip code. You could look at the county. You can look at the regional focus as per what Mandy was looking at, obviously state aggregate level data. So you can kind of zoom that lens in and out in a very easy functional way here. So we do want to ask if anybody has questions or comments that they'd like to share with us. You can go ahead and we'll unmute you. If you've got yourself muted, you can unmute yourself to ask questions. So let me just pause and see if anybody has any comments, questions they'd like to share with us. And as we are kind of waiting and giving that opportunity, I will also take a moment to remind you, we do have our own dashboard that we've been working on through the Conferences Planning Committee and the data work group, and our next webinar that we will be sharing with you, which is scheduled for February 26th, will be addressing that dashboard, which is another collection of some great resources that you can use for planning purposes. So be mindful of that. And also in March, we're going to do a webinar to talk about the range of some of the large state initiatives that are happening right now. So that'll be happening in March. So look forward to some correspondence to talk to you about when that will be scheduled so you can participate in that one as well. It's going to be really helpful to clear up some of the confusion that some folks have about all these different initiatives that are occurring. So let me again just pause and say, does anybody have any comments, questions from the concrete as to how I get to do this thing, or regarding possible uses for this information? Some of you are hopefully will take the time in the near future to poke around in this Dsrip dashboard to see if you can explore some of this data for yourselves. Any thoughts, comments, questions?
One thing I did want to add, and they may have mentioned it at the very beginning, but this is all related to Medicaid claims. So it's just a portion of some of the service utilization that we would see. So when we're looking at things like emergency room visits or inpatient admissions, we know that that's a service that really has a very payer mix, and Medicaid isn't always the best full universe indicator of that service use, but it can really be a proxy for getting a handle of what the inpatient or the emergency room visit may look like.
I think that's a really good point, Mandy. Sometimes when we're looking at a particular set of data, it's easy to forget that it is the subset, obviously just the Medicaid data, but a very critical subset for us to explore, but always important to keep that in mind that there are obviously other payers here for all of these services. We're just looking at that particular element. We do have a little bit of an echo. Maybe if you're not planning to ask a question, go ahead and keep yourself muted, but let me ask again if anybody has any comments since they want to share. Okay, I think that, also what we can do is have an ongoing dialogue. I'll certainly offer if people want to share with us via email or by phone. If you do some exploration and you have some thoughts, one of the things that's nice to be able to do with a community of practice as we're trying to create and maintain here is for somebody to do some exploration of this data and then to share it with your peers. So I would very much welcome if any of you do look at this data, find something useful to the behavioral health planning functions, to enhancing service, to managing your systems of care at the local level, county level, and or particularly at the regional level, since that's where we're trying to focus related to RPCs and some of these other regional efforts, that you then share that effort. You can certainly send an email to me, contact through the conference, so that we can then distribute that. I think maybe Betsy Mulvey would be a good point person. We could then distribute that to everyone if you do some poking around and exploration of these Dsrip dashboards. One last shot to see if anybody's out there with any questions or comments. Anybody have any thoughts? With that, I will ask Mandy or CCSI folks, Ann and Michelle, are there any final comments or thoughts that either of you want to share?
You know, the only thing, Matt, might be worth sharing is we'll get out to folks with a quick feedback form before the end of the day, and be great to have your input on, you know, the utility of this webinar. If you've got any questions or suggestions for what might be helpful going forward, use that as an opportunity to give us that feedback, and we'll use it to tailor future sessions.
Excellent. Thanks, Ann. How about you, Mandy? Any final thoughts as we wrap up?
No, like you and Ann said, if folks have questions, feel free to put it on the feedback form. Or if there's other ways we can share the use of this data, we would be interested in doing that.
Excellent. Yeah, that'd be a good use of that feedback form to go ahead and ask any questions that might emerge for you. All right, then. Well, on behalf of the conference, on behalf of CCSI and all the folks who've been participating, again, I want to thank Ann and Michelle at CCSI. I want to thank Mandy for sharing her example. I want to thank all of you for joining us and discussing this, looking at this with us. So I hope you have the opportunity to look at it for yourselves, maybe share it with some of your team members, share it with providers, other folks who you think might be interested in exploring this data. And we look forward to continuing to talk with you. As I said, we'll talk on February 26th in terms of the dashboard that we've been developing. And in March, we'll be talking about the state initiative. So tune into those webinars, and we'll be getting some information out to you about those in the coming weeks. Thanks, and have a good rest of your day.